So, if I today just patient has cavities on these class one, class one, class one, class one pick, and there are no caries in this. But this line is prone to cavity. So you have these lines which are prone to cavities. These ones, these lines which are prone to cavities. Okay, some these lines are prone to cavities. So this patient, this one, you have all those cavities in these lines. So how to prevent? There are two ways of filling them. One is to drill them because we have to drill it. We have to drill them cavities, clean it, and then fill it. Example, I'll show you. So on the upper, I have now cleaned the cavity. Is this we have cleaned the cavity here. So this is partial drilling. Clean the cavity, and then fill it. Once it is clean, then I'll fill it. Okay. Okay. This also has to be drilled partly, and then I have to fill it. These lines. Now, these are early cavities, so I need to drill and fill. But I recommend that the teeth which are which does not have cavity, like this premolar doesn't have a cavity. You fill them, you seal these lines. Same filling without drilling is sealant. Same filling after drilling is filling. So filling the material after drilling, filling the material before drilling. This is going to last longer, which is without drilling. No, you can prevent the cavity. This is after drilling, it is going to last, but little less. Now when the cavity becomes bigger, see this is now this is a cap. Somebody has kept this a cap. The cavity occurred on the side wall, so we have cleaned it, and this is a bigger trapezoid. So I need to place an inlay. I have to put an inlay because I don't have to cut the whole tooth. I'll place an inlay. I will not cut the whole tooth. So if uh, but whenever there is a side wall cavity in this, suppose see example, there seems to be a small cavity patch on the next tooth. It may be small, it may be large, we don't know, but we have cleaned this tooth. It doesn't require root canal, only inlay is possible. Filling is not possible, the side wall is not there, filling breaks off. So in this also, now in the joint, I have to clean from here, and if it is small, this much size, I'll fill it. But sometimes the cavity is width-wise more trapezoid. So wider trapezoid, I have to do a inlay. A narrow trapezoid, I can do a filling. So it is always better to get a filling done, better to have a sealant done, then filling, and then inlay and a root canal. The inlay will last, sealant will last longest, then a filling. Filling will last for maybe one filling will last for 20 years, a inlay will last for maybe 15 years, a crown will last for 10 years. So the cost also goes. A filling, one sealant will be 1,500 rupees to 2,000. The filling will be 2,500 rupees to 3,500. Inlay will be Inlay will be cost more. So inlay will be a little more expensive depending upon the kind of inlay you the material choice will cost you 10,000 rupees to 17,500 rupees inlay. In crown, you're doing a root canal, then doing a filling, and then putting a crown. The cost will be more expensive, but the crown lasts longest. Less. So more the enamel you cut, less the tooth will last. So it is always better to come till in 6 months so that one cavity is, if it is occurring, it is filled so that it doesn't spread to multiple teeth. Now, op, in this patient, in your case, I'll tell you, I can just seal it. I will filling. I can fill it. I have to put an inlay, and I have to replace this crown because there's a X-ray shows a cavity underneath the crown. So I have to cut the crown, take it out, do a filling, and put a cap. Again, root canal not required for this. Repeat root canal is not required. Root canal is okay. So the best is in concise sealant. Second best is filling. Third is inlay. Fourth is cap.